Turning 65 is a major milestone, and one of the biggest decisions you'll make during this stage of life is choosing the right Medicare coverage. Should you choose a Medicare Advantage plan, also known as Medicare Part C, or should you choose a Medicare Supplement plan, also known as Medigap? The truth is, there is no one-size-fits-all answer. The best option depends on your health, your budget, your doctors, your prescriptions, and how much freedom you want when it comes to your medical care. Friends, family, and neighbors may all have opinions, but your health care needs are personal to you. So today, let's break this down in a simple way so you can better understand your options and make a more confident decision. Let's start with Medicare Supplement insurance, also called Medigap. With a Medicare Supplement plan, your main coverage is still original Medicare. That means Medicare Part A and Medicare Part B are handling your medical coverage. The supplement plan helps cover some of the gaps that original Medicare leaves behind. That can include deductibles, coinsurance, copayments, and the 20% that Medicare Part B typically does not cover. And one of the biggest advantages of a Medicare supplement plan is freedom. If a doctor or hospital accepts original Medicare, your Medicare supplement plan will generally work there too. That means you usually do not have to worry about networks, referrals, or prior authorizations in many cases. You have more flexibility to choose your doctors, your specialists, your hospitals, and even treatment centers across the country. Now here's something many people do not realize. Medicare supplement plans are standardized by the federal government. So, for example, a Plan G from one company provides the same medical benefits as a Plan G from another company. The difference usually comes down to the monthly premium, company reputation, customer service, claims experience, and long-term rate stability. And if you live in Florida, there are some additional details worth understanding. Florida is considered an issue age a state for many Medicare supplement plans. That may help you lock in a more favorable premium depending on when you enroll. Some companies may also stop increasing rates based on age after a certain point. This is why it is so important to review a company's history of rate increases before choosing a plan, because the cheapest plan today may not always be the best financial choice long term. Now let's talk about Medicare Advantage plans. These are also known as Medicare Part C. Medicare Advantage plans have become very popular, and there are good reasons why. Many of these plans may offer low monthly premiums, sometimes even $0 premiums. They may also include prescription drug coverage, dental benefits, vision coverage, hearing benefits, gym memberships, transportation assistance, and even over-the-counter allowances. For someone who is relatively healthy and does not need frequent specialist visits, Medicare Advantage can be an attractive option, but it is very important to understand how these plans work. Unlike Medicare supplement plans, Medicare Advantage plans typically use provider networks. They may also involve referrals, copayments, coinsurance, and an annual maximum out-of-pocket limit. So while the monthly cost may be lower upfront, your costs can be higher when you actually use medical services. Another important factor is prior authorization. Certain treatments, procedures, medications, specialists, or tests may require approval from the insurance company before they are covered. For some people, this works perfectly fine. For others, especially people with ongoing health conditions or complex medical needs, it can feel frustrating and restrictive. That is why the best Medicare plan is not always the one with the lowest monthly premium. The real question is whether the plan truly meets your healthcare needs. Before choosing between Medicare Advantage and Medicare Supplement, ask yourself a few important questions. How often do I visit doctors or specialists? Do I want the freedom to see providers across the country? Can I comfortably afford a monthly premium? Would I rather pay more each month for predictable costs, or pay less monthly and handle co-pays as I use services? Do I travel often? What medications do I take? And am I enrolling at the right time to avoid penalties? These questions matter because choosing Medicare coverage is not just about picking an insurance card. It is about protecting your health, your finances, your lifestyle, and your peace of mind. The right decision depends on your medical needs, your budget, your doctors, your prescriptions, and your long-term health care goals. That is why speaking with someone who understands Medicare can make all the difference. I'm Joe Alexander, an independent insurance broker with Fortress Financial Solutions. My goal is to help educate and guide you so you can make confident, informed Medicare decisions. If you have questions about Medicare Advantage, Medicare Supplement plans, prescription drug coverage, or enrollment timelines, feel free to reach out. Your healthcare future deserves careful planning, not guesswork. And if you found this video helpful, subscribe to the channel for more Medicare education, updates, and tips to help you make smarter healthcare decisions.